Hi, I'm Dr. Jeff Kieliszewski. Welcome to my weekly video blog in forensic psychology. Today I want to spend some time talking about different types of sex offenders. Now, a warning, some of the things I might talk about today might be rather disturbing for people to hear. So just beware if you want to continue to watch. Another thing a point I want to make is that although as I get into the discussion, it may appear that I'm talking about sex offenders rather casually. But I want you to understand that I don't view the problem of sexual abuse as something that's casual. In fact, it's a very serious problem that sometimes devastates people's lives if they are the victim of sexual abuse. So if I talk about these types in a rather casual manner, please don't misinterpret this as me sort of thinking about sexual abuse as something casual and not serious. Now, people tend to have rather strong emotional reactions towards the idea of sex offending or sex offenders, and that's understandable. People a lot of times will also have the reaction of scratching their head about why would someone actually do that, engage in a sexual offense, knowing what kind of damage or problems that can cause to people. Or you might even become curious about why would someone even find that at all sexually stimulating. So I scratched my head about that as a graduate student when I was interviewing prisoners and doing intake psychological evaluations in the Iowa Department of Corrections. So I actually did my dissertation on sex offenders. Now, there tends to be a lot of confusion and misunderstanding about sex offenders as a group. The first thing to understand is they're not a homogeneous group. So today I'm going to talk about some general types of sex offenders. Why should we care? Why should we have types? Well, as a forensic psychologist, trying to understand why an individual would commit a sex offense, knowing the research behind specific types of sex offenses and specific types of sex offenders is often very important in order to make some determination or opinion about a person's risk to offend. This can help in sentencing or in other aspects of criminal proceedings. Also, certain types of sexual offenders respond to specialized sex offender treatment. And there are other types of sex offenders that I would argue really are not amenable to treatment. So that's important to know as well. So what I'm going to talk about today is based on the research on sex offenders, but also my 25 years of clinical experiences with them. The discussion will mostly focus on what is known about male sex offenders. There are female sex offenders, obviously, but they tend to be a very small population, and they're often quite different than male offenders. Maybe that'll be a different video blog later. So for our discussions today, I want to break down the large group of sex offenders into three types of offenders that I often see. The first one are offenders of adults, or people who sexually offend against adults. The second group I'm going to talk about are sex offenders who offend against children. And the third group is what I call the paraphilia or fetish type offenders. So let's start out with offenders of adults. Basically, this group can be characterized as offenders who rape. So this is a sexual offender who often uses some mechanism of force to sexually assault another adult. Basically, within this group, there are two types that I'll see. The first one is what I would call sort of the violent force sex offender. And these are sex offenders that it's a very specific type of offender who utilizes a lot of violence, oftentimes more force or violence than is necessary to carry out the sexual assault act. Now, this type of offender is what gave rise to the idea about rape being a violent crime rather than just a sexual crime. So these types of offenders, in my opinion, tend to have less amenability to treatment and higher risk to offend violently or sexually violently against others, particularly if these types of offenders are violent towards strangers. So this would sort of fit into the stereotype of a rapist or a serial rapist. The sort of, for lack of a better word, reward that these types of offenders get out of their violent sexual act tends to include that combination of sex and violence. And this, in my opinion, makes these types of offenders some of the most dangerous. Now, there are also offenders of an adult that I would call non-violent force types. And these would include individuals who sexually assault another adult when the victim is not able to give consent or can't consent to the act. This category of offender oftentimes will be offenders who drug their victims, groupies, slipped into your drink, assaulting someone who's passed out due to acute alcohol intoxication. Or you could even argue the nonviolent force types may fit more into kind of the date rape scenario, although that would be arguable depending on the amount of force that's used. The second type of sex offender that I want to talk about are offenders of children. There are two basic types within this group. There are pedophiles and non-pedophiles. Now, pedophilia is characterized by a specific sexual attraction and experiences with prepubescent children. So pedophiles are into victimizing children who have not hit puberty yet. Now, there's several subtypes within pedophiles. There's pedophiles that are attracted to males, pedophiles that are attracted to female children, pedophiles that are attracted to both. There's also what's called an exclusive pedophile, that they only have sexual attraction towards children and no sexual attraction towards adults. And there are also non-exclusive pedophiles, which are sexually attracted to both adults and children. Now, each one of these subcategories bring in certain different dynamics into the offending cycle, but also different levels of risk. And the forensic psychologist has to pay attention and build some of these folks into these typologies to understand the research behind that. Now, there's also non-pedophile offenders of children. This is characterized by offenders who have sexual attraction and experience with children, but the children are in puberty or post-puberty. So basically, offenders who target teenagers. Now, sometimes in the literature, these types of offenders are known as I always get this wrong, ephobophilia. A lot of times in the media, what you'll see this mistake where, so for example, the Jeffrey Epstein case that's in the news a lot, they'll talk about him as a convicted pedophile. Well, he's actually doesn't meet the criteria for pedophilia because his victims and his alleged victims were at least teenagers. So there's a difference, and this also is important for the forensic psychologist to understand, because the risk level of a pedophile versus a non-pedophile offender of children can be quite different. Now, there's a third group. This third group is what I like to call paraphilia or fetish type of offenders. This group of sex offenders tends to engage in sexual offending behavior from a distance. So these include offenders who commit crimes that involve exposing themselves for sexual gratification. We used to call these folks flashers. Window peekers. Now, with technology, these types are the types that set up cameras in bathrooms or in locker rooms. There's also sort of the, again, I apologize I talk so casual about it, but this is something I talk about every day, kind of the upskirt guys, people who try to take pictures with their cell phone underneath women's and girls' skirts. The other part of these paraphilia, non-fetish type offenders are the child porn guys. I'll talk more about them in a minute. But the third group, the paraphilia fetish type offenders, typically and generally as a group tend to be more amenable to treatment. And with good treatment, a lot of times show much lower risk to reoffend. Now, a caveat to this group, the child porn offenders. So child porn's been around for a long time, but nowadays it's so easily accessible to people. And it's actually sort of a newer phenomenon, that easy accessibility, that the research hasn't quite caught up to understanding the dynamics involved in child porn consumption and how this relates to risk to offend. So the research is still out. We still, in my opinion, don't have a body of research yet that we can draw practical conclusions and applications towards risk assessment with sex offenders yet. So defining different types of sex offenders just sort of scratches the surface on the multitude of variables that forensic psychologists have to look at in order to understand a sex offender and in order to conduct a risk assessment of this offender. Other variables, for example, are: was this an incest offender? Was this a stepfather offender? The age of the victim is often important. The type of offending behavior, specifically what type of offending behavior. The mechanism for offending. So, for example, offenders who groom younger victims versus those who engage in spontaneous sex offending or sexual assault. So there's a lot of things that the forensic psychologist has to look at. Oftentimes, offenders will fall in generally to that typology, the three types that I presented. Now, it would be unusual, but not impossible, for example, for a pedophile to also engage in rapes of adults. Now, it can happen, but that's less common, and a lot of times offenders sort of fall into these typologies. Now, if you do have an offender that falls into more than one type of typology, the research would suggest these folks tend to be at more risk to reoffend. In the old days, in the old literature, they used to call this group the polymorphous perverse group. Now, although the research is still trying to sort of shake out and understand the relationship between child porn consumption and actual risk to offend children, like I said earlier, this is a newer area. I kind of have a bit of a hunch about that based on the people that I've seen. It seems that there are kind of two types of sort of the child porn guys. There are the ones that are using or consuming child porn as a way to sort of fuel or practice this desire towards offending to children. But there's also a group that, in my opinion, are using child porn because there's such a taboo that's associated with this level, with this type of pornography, that it tends to be more stimulating for them. So I'll see these guys who've never sexually offended against a kid, and these are the guys that oftentimes will tell me, well, I was just curious. But then you read the police report and they had 6,000 images of child porn categorized into specific files. A lot of times those types of guys tend to look more like people who have problems with sexual addiction behaviors. But like I said, the research is still trying to sort that out. All right, so I took a very big subject and tried to squeeze it into 10 minutes. If you have any questions or comments, please comment on the video, or you can email me. My email link is on the YouTube webpage. Also, if these are topics that interest you, please subscribe to the channel. You can also check out my Facebook page. I put things on there from time to time. Also, pass this link along to others who may be interested. Thanks.